I'm Dr. Anthony Collada. I'm a board-certified psychiatrist. This video, I'm going to respond to one of the questions I got where one of the viewers or one of the commenters asked specific questions related to schizophrenia. And the questions include what happens if schizophrenia gets untreated, how long do episodes last, can people get better without medicine, what is the best antipsychotic medicine for schizophrenia now, and what is the life expectancy of people with treated versus untreated schizophrenia. So just to summarize, schizophrenia is like a psychotic illness where people can have either hallucinations or delusions or disorganized behavior, or maybe it affects part of their life where they can't speak much, they don't have much thought, and it goes on for most of the time over a period of at least 6 months. And it's not due to like any drug use or any side effects of medications or medical conditions. It's just the psychiatric illness. First of all, there's different phases of psychotic illnesses. There can be a brief psychotic episode, which is less than 1 month. There can be a disorder called schizophreniform disorder, which is between 1 to 6 months. And then schizophrenia is when it's greater than 6 months. So to have a disease like schizophrenia, it's pretty significant. And by that time, there's a good chance there can actually be these neurochemical changes in the brain, and these changes in the brain neurons from the disease process. And so if schizophrenia gets untreated, well, initially when people develop these psychotic illnesses, they get the hallucinations or delusions. The hallucinations such as seeing things that aren't really there or hearing things that aren't really there. Or they get these delusions, which is like a fixed false belief. And those are what the common medications nowadays will target. So the antipsychotic medications that we commonly prescribe address the hallucinations. They can address the delusions a little bit, but not that well. But when schizophrenia progresses and gets prolonged, then it gets to the point where people start to withdraw. They don't want to have social interactions. They don't talk much. They have very flat facial expressions. And when it gets to that point, it's much more difficult to treat with psychiatric medications. The most effective medication that we have nowadays for schizophrenia is clozapine, but clozapine is not often prescribed in the United States because it requires frequent blood monitoring. In particular, it requires weekly blood monitoring, at least for the first 6 months. Then the next 6 months, it's every 2 weeks. And then after that, it's every month for the duration of people being on this medication. And the medication has several possible side effects, not just the weight gain and the risk of diabetes. It can also affect the blood, can affect the heart. People can tend to salivate a lot on this medication. So in short, it's not really that commonly prescribed. And in order for someone to take it, they have to be a really compliant patient. Compliant meaning really willing to take medications. And unfortunately, just due to the nature of the schizophrenia disease, a lot of people do not want to take medications for this illness because really they don't believe that they have an illness. So what is the life expectancy with treated versus untreated schizophrenia? Well, just with schizophrenia in general, the life expectancy is not going to be as long. When it comes to people who are treated with schizophrenia, they're on these antipsychotic medications, but if they don't take good care of themselves, they're going to have weight gain, they're going to have high cholesterol, they're going to have cardiovascular disease, and so it's going to shorten their lifespan in general. I think the most disturbing thing with untreated schizophrenia is that people are not going to be in touch with reality, and so they're not going to be able to take care of themselves. They may be using drugs or homeless, or they may just not be able to care for themselves. So I'd imagine the life expectancy with untreated psychosis or schizophrenia is much less than with treated schizophrenia. And then lastly, can people get better without medicines? Well, you have to look at what the possible underlying cause is for the schizophrenia. We're not really sure, but we think maybe it's a combination of genetic predisposition with environmental stress. So if you take care of the environmental stress, maybe that'll help with the psychotic symptoms. There are other ways to treat hallucinations besides medications. For example, prayer has been shown to help with auditory hallucinations. Also, listening to music can help with auditory hallucinations as well. For the delusions, maybe approaching it through therapy can help to bring someone back to reality and to not have these delusions. But again, when it gets to the point where it's actual schizophrenia disease, it's been going on for at least 6 months. And so oftentimes psychiatric or medical intervention will be needed to address it.